Okay, let's finish up with section 4 and section 5 of part 2 of Harrison's 21st edition. There is not much change in the eyes and ears, but nose and throat has been changed a lot. So disorders of the eyes is same, there is not at all any change. And in disorders the smell and taste, this table 33.1 has been rearranged and many subclassification has been done. It was not like endocrine or metabolic disorders, immune related diseases, neurological diseases. So these subheadings are there. It was not there in the previous edition. So go through table 33.1 in the 21st edition. Disorders of hearing also, there is no change. I will skip it like that only. Signs, everything is same. But the thing is that whole of the 35 chapter 35 is rearranged, and it's been most probably appears like as if somebody else has written the whole chapter is changed, and more emphasis has been put on antibiotic usage, because as you can see in the COVID era the antibiotic usage has been rapid. So they have cut a short on antibiotic usage, and there is clear cut guidelines on how to use antibiotics, and all is clearly given in upper respiratory symptoms including earache, sinus symptoms and sore throat. So they start with upper respiratory infections, and they call it as the average adult has 2 to 4 upper respiratory infection and children have 6 to 10, and they focus on COVID-19, and immediately they go for improving ambulatory antibiotic prescription and antibiotic stepwise how to use it and all, and subheadings and everything has changed here, and you have to go through this chapter as a whole for the antibiotic usage. For every condition they have given indications for antibiotic treatment in acute otitis media, in sinusitis, indications for antibiotics in sinusitis. As such, in chronic sinusitis, clinical findings that suggest various forms of non-streptococcal pharyngitis, and the Centaur criteria and the probability of streptococcal pharyngitis in adults. So these are all very important, because after COVID-19 there are many, all sore throat has to be differentiated, what is right and what is wrong. So an antibiotic treatment of group A streptococcal pharyngitis, this is also a new table. Most probably they have mixed the streptococcal infection along with the upper respiratory infections as a whole. And in oral manifestations of diseases there is nothing new as such. Whatever is there, and nothing new has been added. Only in section 5 in dyspnea there is a new figure, that is signaling pathways underlying the dyspnea. Underlying dyspnea it's a new figure, you have to go through it. It's a good one, how the air hunger, chest tightness and all happen with the different afferent signals and efferent signals. Other than that, the dyspnea scale or dyspnea classification, underlying causes, all these figures are same. Cough, almost all is same except that there is a new saying like chronic cough hypersensitivity syndrome. In the absence of identifiable etiology has been recognized with increasing frequency, is thought to be due to exaggerated neurological signaling via sensory cough reflex pathways, and that's referred as chronic cough hypersensitivity syndrome. Other than that, everything like assessment and everything are same. Again here the causes of impaired cough and airway clearance, they have increased the causes. Earlier it was only till central respiratory depression, example anesthesia sudden or neurological disease. They have added many more like chest wall or abdominal pain and cilia, this bronchiectasis, tracheal or bronchostenosis, ciliary dysfunction, many have been added now. And hemoptysis, there is nothing much. Hypoxia and cyanosis, also there is nothing much. Edema also, nothing has been added. So up to approach 42 approach of the murmur also, the approach in the cardiac findings there will be nothing as such in the guidelines of the ischemia and all. In the heart diseases like cardiology they have changed a lot, but till then palpitations also same. So section 6, till section 6 there is only one chapter difference, and some tables have been slightly rearranged. Otherwise section 4 and 5 are insignificant. You can just other than that chapter you can skip many things. So we will start with section 6 and 7 in the next year. Thank you.